Welcome everybody. The Really Healthy Company is delighted to introduce Dr. Edna Lao. She is a specialist in holistic medicine with over 30 years of experience. Dr. Lao currently runs the successful Dr. Edna Lao Medical Clinic in the Philippines. She's trained in acupuncture, chelation therapy, homo-toxicology and homeopathy. Dr. Edna has also been the president of the College of Advancement in Medicine and the National Chancellor of Alternative Medicine in the Philippines. Today we are honoured that she will be sharing her unique insight and clinical experience with us. Welcome Dr. Edna. Thanks so much for joining us.
Yeah, okay. So is it good? Yeah, good afternoon, everyone. It's good evening here in my country, and I'm just happy that I can be with you today, in this afternoon. A little bit of addition to what Luisa was saying. I'm practicing here in the Philippines using holistic approaches. So it's not only one aspect, it's really more of holistic. So I will be using different modalities, whichever is the necessary treatment that I will be using for the particular patient. So this presentation I'm going to give would mainly be more of the practical side of my practice. My experiences and my several years of dealing with patients. I used to work in the hospital. I had training in internal medicine, and so to add a little background to how I became a holistic medicine practitioner, I was trained in internal medicine, and one day, my mother got sick with a tumor, and she would not agree to any treatment using the mainstream allopathic medicine. Even if I was already a doctor, she would really want to go for holistic approach, basically herbs and the natural way. At that time, this is about 30 years ago, I was vehemently protesting for her to go into that kind of approach because that was not what I was trained for. But she insisted. Can you please hold on the line? But she insisted. Okay, is it better? This light. Can I lower it a little? Okay, so going back to my story, my mother got sick, and so she did not like my going into allopathic medicine. The recommendation was for surgery, whatever mainstream could recommend. She went to look for a doctor who could recommend natural approaches. So she was able to find one, and she was with that doctor with me protesting along the way. But despite of my protest, she still went on with the treatment. So to make a long story short, she got well after 8 months, and with that, got well meaning the tumor was gone. She was really okay, and she was just using all naturals like um, vegetables, herbs and all this. And after she got well, I wasn't still yet fully convinced natural medicine. It's very difficult to accept that what I was trained for so many years wasn't really, the best thing apparently because my mother got well in another way. So I wasn't convinced, but I got married and I got pregnant. I had 3 kids, and one pregnancy after another. I was having difficulty going to the hospitals, doing my rounds. And my mother's doctor, who was also an MD, but she was into natural medicine, she convinced me to go to work with her. And I agreed to work with her mainly because I liked the working time because I would not be going on duty at night. So I would be reporting to her clinic 8 8 to 5. So that's basically why I joined her. But in her clinic, I tried to observe what she was doing and people getting well, and she was recommending all these kinds of herbs. I wasn't really happy, using just the herbs because I could not understand why it would work or the mechanism behind. But luckily, I got there was this doctor who was a Filipina, but she was working in Germany for quite some time, and I think she had practiced in Germany for around 20 years or so. And she came to the Philippines and gave a talk
Dr.
on
Lao,
about her practice. Yes.
apologies. The sound is not good at the moment. I wonder if there's anything we can do to.
Sorry. Maybe it was the electric fan.
Oh,
How
that
about
sounds
that?
much better. Yes,
Sorry.
that sounds
Sorry.
much clearer.
Okay.
Thank you, Dr. Lao.
Okay.
Perfect.
Sorry. Sorry. Okay, so going back, yeah, I met this doctor and she's a Filipina and she gave a talk on holistic medicine. And after by the way, she introduced herself as coming from Bohol. You know, these chocolate hills I'm showing this? This is in our province. And she said she's coming from our province. So after the talk, I approached her, doctor, I'm from the same province. And then she got excited and she said, you come and see me in my hotel. And I went to see her and she offered to send me to Germany for training on homeopathy. And of course, I went. And then after that, she invited me because at that time she was already living in the States. So she invited me also to go to the States to get my certification in chelation therapy. So this is how I got introduced into holistic medicine when I started to go to these formal trainings on holistic medicine. Like I would be listening to lectures of really reputable scientists explaining the reason behind this kind of practice. Unlike, the shaman thing, which is like in the Philippines, they would just use the herbs, but they could not explain to me why it would work and how it would work. But in my trainings in Germany and the States, that's when I fully understood what was the paradigm of holistic medicine. So, okay, so where is my slide? How do I put on my slide? Okay. So the principle, so let's go now to what is really alternative medicine. This is just a sort of a backgrounder so that it will be easier for me to explain later the reason why I would be doing this kind of treatment for this particular patient. Okay, so with alternative medicine, um, we believe that a degenerative disease doesn't happen overnight. No, we believe that it happens it starts years before it will really manifest, and so it's not like an acute thing that you can just manage right away. We want to dig up what happened years before, and that's when we would start to try to treat it from there. Um, it is never where it is also. We also believe that it is never where it is, meaning unlike when you are using the allopathic paradigm or the mainstream paradigm, like for example, if a patient is complaining of a skin disease, the patient would go to a dermatologist. But if you go to a holistic doctor, I would think, for example, that it is not just about the skin. We understand or we believe that it is highly correlated to something that is inside. And most of the time, the skin is correlated to the intestine, a dirty, toxic intestine. So it is never where it is. Like you have the light, the bulb, but you don't see the switch. So you have to go and look for where that switch is. And that's how we we approach a treatment strategy using alternative medicine. And then we strongly believe that in all these diseases, in all the manifestations, in all the symptoms, it has to be there has to be a very strong immune response in order for us to achieve healing. We cannot just forego or ignore the immune system. Unlike in Western medicine, it's more of symptom control. So if you have for example, the patient comes in complaining of, as going back to my example, the skin disease, the patient would be given maybe topical steroids or creams just to make the inflammation or the rashes go away. But the doctor would not really go so much into strengthening the immune or even looking for where it could have come from. As long as the symptom has disappeared, then it's considered already done. No? So that's the main difference between the two. So, oh, sorry. So yeah, so as I was saying, so because of that kind of paradigm, we are very concerned as to the cause because we really want to know what is the cause, and that's where the treatment should come from. That's how holistic medicine views a disease. We look for the cause. In allopathic, we also look for the cause, but mostly it's about controlling the symptoms. Like, for example, if you are complaining of hypertension or diabetes, the patient is just given an antihypertensive or an anti-diabetic, and the patient is told, okay, this is your maintenance, because the treatment is just really to control the symptom. That's why it's called maintenance. If you take off the maintenance medication, the symptom comes up again because you did not really go to where it's coming from. So this is the I think the difference between the two approaches. So we determine the cause. So, and nowadays we are very, very aware that most, as in fact maybe 100% of the cause of diseases is toxin related. Well, toxin is not just food or chemicals in the food. So many toxins now are bombarding the body. So not only food toxins, even thought toxins, spiritual toxins, emotional toxins, so many other toxins. But to start off, let's go first to the basic, wherein we check first the environmental pollutants. Is the patient working? Like, for example, if a patient comes to me in Manila and he is working in Manila and he has cancer of the lungs, I would always tell the patient, if you really want to get well, you have to leave Manila or you have to leave the city, because what's the point in treating? It's just like a fish swimming in a dirty aquarium, and then you pull out the fish, you treat the fish, and then you put him back to the dirty aquarium. So what's the point? No, it will not really completely achieve the healing that we want. And that's the frustration, because in real life it's difficult to do, especially with people working and people wanting to make a living. I am having a clinic in Manila. I also have a clinic in my province, which is the province, in the provincial atmosphere. And there's a big difference between these two groups of patients. My patients in Manila are difficult really to manage. Well, my patients in the province, I just tell them, oh, go to the sea, bathe in the sea, or go to the farm and then change your food. Your food must be farm to table, and then you have to have fresh fish and all this. And the healing is very, very significant. In Manila, for example, if I would expect healing of my patients in the province like 190, 95% good in Manila, I will never be able to achieve that. I can only probably achieve maybe 75 to 80% well-being of the patients, but they will never be reversed unless they leave the metropolis. Now, like for example, several years ago, maybe 3 years ago, my colleague who is also she was a gynecologist and she believed in holistic medicine. Although she was practicing holistic medicine, she was believing in natural medicine because she was a Seventh-day Adventist. And we know that Seventh-day Adventists, they do not eat meat. They they are very vegetable oriented. Most of their food is vegetables. But this colleague of mine, she died out of cancer of the colon, which is 10 centimeters big. So it's really like, oh my God, how did she get that? I mean, if you're supposed to be somebody who's very conscious with your food, how can you get cancer of the colon that big? And so I started to think maybe it's coming from the vegetables. Even if, well, she was a vegetarian. So even if you're a vegetarian, if your vegetable is loaded with all the pesticides, all the insecticides, all the fungicides and everything, it's nothing. I mean, it's pointless to be vegetarian and still also eat vegetables loaded with toxins. So that's how toxins really are. This is the bane, I guess, of the 21st century. So yeah, so as a matter of fact, to prove my point, I brought my family. We went to the vegetable capital of the Philippines because I was interested to really prove my point that the vegetables are really loaded with toxins. And we went there, and oh my God, it's so, the whole place is really full of pesticides. As a matter of fact, the stores on the sides of the roads going to the farms, they are selling in retail the pesticides and the fertilizers and all this. So that's the reality. So that's one thing, okay. So, and then yeah, I'm talking about now the chemicals in the food, and then so we try to detoxify, but then as I was saying, if that is the life that we lead, you will just have to re-intoxicate. I mean, you would not like that, but we cannot be in a sterile environment. We live in a toxic environment. So that's the reality. Now, okay, so this is just some of the slides to show that the metropolis really is so polluted. Now other toxins would also be food, of course. Food we were talking about the environmental pollutants, and this is now the food pollutants, food toxins, which are really um, uh, metropolitan food, metropolis food. Because if you're living in the province, you would go for the root crops, you'd go for the boiled bananas, you'd go for the papaya. But this one are donuts and the cakes and the pastries. These are what's available. And of course, these drinks and all these foods, these are city food. If we had these drinks in the city, this would be replaced with buko juice in the province, or maybe a lemon juice, so that's okay. So I was talking about detoxification and food. So how are we going to get rid of the food that we get inside our body to get ourselves cleansed? And one big I think a fault of humanity or the modern day man is the toilet. This is our regular toilet, and this person is sitting down. But ideally, we should be sitting this way because this is the draw. This is how the intestine looks like, and these areas should be pressed so that there are no fecal materials left here. So this is the ideal way of moving our bowels, unlike the one that's sitting down. This one. This is not this is not ideal, or although this is more convenient and more modern, I think. But the thing is, this was according to the book which I got this from. This was from Dr. Jensen's book. This was created by a carpenter, not by a doctor who knows, who's supposed to know the anatomy. So this was created for convenience. This should be the ideal way of defecating. Now, okay, let's go to the detoxification pathway. These are the toxins and what is the organ that is most responsible in the detoxification process? Of course, it's the liver. And we know that the liver needs all these nutrients for it to be able. Most of the toxins, by the way, that we get from the food and the environment are, we call them fat soluble, meaning they are they are mixed, they are embedded, and they can be mixed with the fat in the body. And the thing is, we cannot excrete fat. We do not move, we do not urinate oil, we do not sweat oil. So if the toxins are embedded in the fat, they have to be converted into water soluble form so that they can be excreted. And it's the job of the liver to do this, to convert the fat soluble toxins into water excretable form using a very important substance, which is glutathione, but also with all the other nutrients that are very necessary in that conversion process. Now, this is an example of, I'm now giving you an example of somebody, going back to our example of the difference between going to an allopathic doctor and a holistic doctor, somebody with a skin disease. So if you had this patient had a skin disease, and if he had gone to a dermatologist, of course he would be given creams and all the superficial treatments. Like going to a holistic doctor would be not, he would not be treated like the dermatologist would do. The holistic doctor would think right away of the situation of the intestine. Related to what I was saying a while ago about the mode of defecation, if the toilet is like that, which is sitting down, it's very easy for fecal material to be left behind. Remember, our intestine is about 36 feet long. So you cannot really move all of those totally if the posture is not really good and you're not doing it daily. And so the toxins are left behind, and we believe that the skin is one exit that the body wants to employ or wants to utilize just to get rid of the toxins. So if that is the backdrop of what the doctor is thinking, the approach should be to clean the intestine, uh, to move the bowels, and to use different approaches to get rid of extra fecal material that might be left behind. Of course, we know enema is one. Um, colonics therapy is one. So here is one case. That person with this foot was subjected to colon therapy, colonics therapy, and this is what they were able to get from his intestine. You see, this fecal material has already assumed the structure of the intestine. That's how maybe prolonged those toxins had been there for quite some time already. It has already assumed the structure of the intestinal structure. So they were able to get this out of him doing colonics and doing enema. And so on the fourth day, this is what happened to the foot. Not really using creams, but it was an internal cleansing. And this is also what happened. So to clean the intestine, yes, we know the colonics. We need high fiber diet. We need enough water. We know that for every pound of body weight, we need 15 ml of water. So if you are, for example, 100 pounds, you need 1,500 ml of water, or 1.5 liters. So that's according to weight. The more surface area you have, the heavier the weight, of course, the more water you need to clean. And then, as I was saying, we do enema, and then we do colonics hydrotherapy. And so this is the seventh day of the patient who underwent all those treatment modalities, targeting the intestine, not much the skin. Well, of course, you have to treat the open wounds, but the inside cleaning, I think, is really the main therapy that ensure the dramatic change in the skin disorder. Okay, so going back to the paradigm, just to emphasize it, we have demonstrated now that it is never where it is. Based on this principle, we can surmise that alternative medicine has a different paradigm from allopathic. We call it allopathic or mainstream medicine. It is not symptom oriented, as I was saying. It is cause oriented. And if in allopathy we're given medicines to make headaches disappear, for example, in alternative medicine we're given medicines to remove the cause of the headache. Not medicines to lower the blood pressure, but medicines to remove the cause of the high blood pressure, and so on and so forth. So if treatment therefore is cause oriented, it means it is looking at the disease as the result of a cause, not just a symptom. Thus, we can have the same disease or symptom, but different causes. The same disease may not therefore have the same treatment because the treatment will be directed at the cause. So there cannot be a standard treatment for the same disease. That's how I do it in my practice. There is no like box type treatment like how we were taught in medical school. If you have all the symptoms, these are the group of medicines that you will be giving, and this is how you'll be giving it. But I observed as I went along in my practice, it's entirely different. It's not how I learned it from medical school. Well, those were theories that I could make use of, but I realized it's the doctor-patient relationship cannot be, there cannot be a book book-based relationship. And it was a frustration for me to realize we were even taught that, you just, like, for example, in the outpatient department, you can only use like 5 minutes, 10 minutes with a patient. Oh, what's your problem? Oh, you have high blood pressure. Or you take this one and then you go out. I mean, no, I don't think that's the right. Well, as I went along in my practice, I learned it cannot work that way. Well, it can work in the sense that it can lower the blood pressure right away, but it will not completely heal the patient. So the key really, one thing is this thing about doctor-patient rapport. It's very, very important. That's why nowadays it's a very big frustration to me that because of this COVID thing, we cannot anymore see the patient face to face. Most of my patients now are online. Like this afternoon, somebody texted me, "Can I consult you about my father's prostate? He is on catheter and he cannot urinate." And this is just like this person was saying, "You were referred to me by a friend." I said, "Oh my goodness, I'm so sorry. I think, how can I prescribe out of imagination? I mean, how can I just imagine what could be happening to the prostate?" Well, of course, I know that a prostate tumor is enlarged, but there's so many other reasons why you cannot urinate. Maybe urinary tract infection, maybe so many other things. So you cannot just imagine. So it's very, very important, this doctor-patient rapport. I just hope this pandemic will be ended so that we can go back to how we were. It's very difficult. As a matter of fact, I don't even like to practice that much anymore unless these are patients whom I've seen before. But to come to see a patient online, and I could not even watch him walk, or because as you talk to a patient, you can see there are so many intangible things that you see in the course of your conversations. the facial expressions, which are now covered by the mask. And in the holistic perspective, the emotion is a very big thing. So sometimes before I would see a patient, she would come for hypertension, and then as we go along in the conversation, I would discover that she's just very frustrated or she's very depressed because she discovered the husband was, having, so these things cannot be treated with an antihypertensive. So that's holistic medicine. So we cannot just be one aspect. So there cannot be one standard treatment for a disease. It has to be, I'm a full advocate of case to case, highly customized management, highly customized. I know my patient, there are patients whom I know that I can just treat by just talking to them. And there are also patients that I really know who are very dependent on supplements, or even some patients whom I really have to give medicines or drugs from the drugstore. So it has to be highly customized. So we cannot say if you have cancer of lungs, for example, is a treatment, or for diabetes, everyone who has it will have this treatment. A person can have cancer of the lungs because he could be a smoker, or he could not be a smoker. He can also have cancer of the lungs because he was consumed with so much grief. Yeah, I had a patient before. She was not a smoker, but she had cancer of the lungs. And in the course of the conversation, the grief was because she's frustrated with her daughter who got pregnant, who was supposed to finish college yet, and she already has this grandchild and all these problems. It was grief. So you cannot really be a customized, you cannot really be a standard treatment for each and every case. So alternative medicine is highly individualized. So this is what I'm saying. Each patient is different, even if they have the same disease. Okay, so still on cause-oriented cancer, the cause of cancer up till now is not yet pinpointed. Yet some get well and some don't. Even if they took the same medicine for the same type of cancer. This I have proven so many times. I had a case before, for example, this particular case, she had leukemia, and for 7 years I was treating her, supplements and all. And one day she became so very weak already, and she said, I'm very tired already. I think I'm giving up. So I said, okay, what are we going to do? I'll just continue your medication, your supplementation, and then let's just see what happens. And she didn't come for maybe a few months, 3, 4 months. When she came back, she's like in the pink of health. She's really like healthy. And I ordered her before she came. I ordered some laboratories, and it was all normal. And they said, what happened? I did not change anything. I just continued the supplements, and nothing was changed in the treatment management. So I said, it cannot be your supplementations or your medication. It has to be something else. And so I said, maybe there's something that happened which is a milestone in your life. And she said, maybe it was because she just had a grandson. She was married for this mother of her grandson, her child, was childless for so many years, maybe 10 years. And then she got pregnant, and then this patient now has a grandson. And I researched, could it be that? And I found out, suppose here in the Japanese, there's a Japanese philosophy called ikigai. It's something that you look forward to. And I think I told her, maybe it was your ikigai. Because, this patient until now, she's alive, very much alive. So it's just one of the, amazing things that I cannot explain in terms of, scientific explanations and all. So there, we cannot also exactly identify the exact cause. Sometimes we catch it. That is why the patient gets well. But sometimes We just don't. No? We cannot therefore say this is the medicine for cancer of the lungs. This is the medicine for this and that. Well, that's the holistic perspective that I have. If I had been working in the hospital, I probably would not have this kind of thinking. I would still go for the standard. If you have this lung cancer, this is the thing that you would prescribe. This is the thing that you would give for cancer of the pancreas, and so on and so forth. So that's how changed I have become. Okay, so it's therefore a challenge to find the cause of the disease, because there lies the key to your healing. I I really feel and I believe that to do that is only through the doctor-patient relationship. For each patient, especially for first-time visits, I usually take 30 to 45 minutes talking, just talking, and digging up, because there are so many things that are contributory to a degenerative disease, and patients do not just divulge it to the doctor in the first 5 minutes of your talk. So you need to have to establish this kind of rapport. So there you have to have that kind, but unfortunately we are not yet 100% equipped really to identify the cause. So we are left with the basics of health, you know, to try to create an environmental milieu that is conducive to healing. So we do as much as we can in terms of background information, um, in updated data and all this, researches. But this is not, we know that this is not complete. But this is at least a basic in the treatment. So the basics would be, as I was saying, detoxification and then cleansing, and then go for the liver, because that's the organ that is very much involved in the detoxification process. And then the liver, of course, works with the intestine, because the liver detoxifies, but it doesn't have an actual exit of the body. It has to throw the toxins that it is removing from the body to the intestine and the kidneys and the lymphatics to be removed out of the body. And then I really would like to emphasize also the emotion part. Yes, very, very big role in the in the treatment, the detoxification of emotions, which is actually difficult because you cannot dig up the emotional connection, the emotional factors in the disease causation from a patient who you just seen the first time. Usually they tell you their emotions after several visits, and then when you get their trust. So this could be a challenge. And then another part of the treatment, of course, is very important, the nutritional supplementations. I believe the body really is very, very amazing if only you give it the right environment, the right food to heal itself. It can really heal. So that's just the thing that in the development of medicine, this is not much given attention to in the 21st century progress, I think. Um, well, lately we are now having a lot of nutritional supplementation, and a lot of companies are coming up. But in the mainstream, still they don't give so much emphasis on nutritional supplementation. It's just viewed as an adjuvant. But in my practice, it's a major part of the treatment therapy. And of course, the third and most important is immune stimulation or immune modulation, of which I should mention BioBrand, this being also a seminar about BioBrand. And I'm very convinced of this. Been using this for maybe 25 years, 20 years. Yeah, so I've never been um, disappointed with BioBrand. We call it Lentin here in Asia. And as a matter of fact, most of my documentations and my documented cases that I'm presenting here are not anymore recent, because several years ago I've already been fully 100% convinced with BioBrand. So it's already just part of my routine. So I'm not anymore amazed as to its ability. So as I was saying to the organizers, I will not have recent documentations anymore. I have not been very conscious about documenting anymore because I'm already very convinced about BioBrand. But I will still be presenting to you some of my cases that I used before or I documented before to convince myself in BioBrand. Okay, so diet. Well, the basic, of course, we know this. Everybody now knows this. No meat. Well, grass-fed meat now is recommended because we've found out that pure vegetarians are not also really that healthy. If you look at our dental structure, we have incisors which are pointed like the feet of the meat-eating animals, but only two pairs. Most are flat teeth, which are for vegetables and food which are not difficult to masticate. So we surmise that we must have a little amount of meat. And I think I would agree to that because in the course of so many years, I've had many vegetarian patients who also got cancer, who also got sick. So I initially in my early years of practice, I was a very good I was a very staunch advocate of vegetarianism. But now, because of the cases that I've seen, I changed my thinking, and I don't really think it's has to be we have to be purely vegetarian. I think the key factor there is that the meat must be ideally grass fed. Is because also of the method of uh, rearing of what you call this, growing the meat. Now they already have this manufactured food for the meat. Not anymore. For example, cows, they already have this manufactured food. They don't. I talked to one guy who owns an ice cream factory, and he has cow cow farm, and I asked, so you have so many cows, you have grazing fields, and said, oh, we don't do that anymore because we don't have enough grass. So he said, we have this manufactured food for the cows already. And I think that is not a good source of meat. So ideally it should be grass fed. That's why I would go for goat's meat or lamb, so all those. And then of course we know already that sugar is a no. Sugar has now been highly researched, and a lot of data point to sugar as the number one culprit of disease, because sugar is a highly inflammatory substance, and any disease process starts with an inflammation. So sugar is a no-no. Well, a lot of people say, you mean to say we cannot really take sugar? There is a recommended sugar. It should only be 4 teaspoons per day. So that's 20 grams. And so you can compute, or you can watch your sugar intake for a day. And then fried foods, of course, because of the the exposure of oils to extreme heat, which makes the food highly toxic when it's fried in very high heated high temperature oil. And then dairy is also now viewed as something which is a culprit, especially with hormonal issues. Milk, because I would also believe on the practical side, like I don't I don't think milk was created by God for adults. You will not, in nature, you will not see an adult animal drinking milk. Milk was created for infants who could not yet take solid food. Of course, it's complete, but once the person is able to eat food or masticate food already or eat the regular food, milk should not anymore drunk. It's really for infants. And that's how it is in nature. You will not see an adult cow drinking milk or adult goat drinking milk. Okay, and then of course no processed food because we know these are full of chemicals, and then we know already that gluten is an inflammatory substance also. So that's part. That's the basic dietary recommendation, and then sick or not, we are told that this is a good dietary lifestyle. Yet after, as I was saying, after more than 20 years, I have also encountered patients who have been meat eaters, as I was saying, and they love Chinese food, but they have lived healthy up to several years. Even, these old grandmas in the Chinatown, 90 years old, 90 plus years old, they eat meat. So, and then, as I was saying, there are also vegetarians who also get serious diseases like cancer and they die at an early age. So, as of now, my stand would be moderation. I think moderation because we have the liver to do the detoxification and we have, the body can get rid of something which it doesn't like as long as it is not overwhelmed. So that's my stand now after so many experiences of all these cases. Okay, so this case is a this was one of my patients years ago. He had Wilms tumor. He had a cancer in the kidney, and his parents brought him because he was undergoing radiotherapy, but his white blood cells or his immune cells were gradually going down. So um, they were afraid that he would contract another, a complication because of very low immune response. And at the time, that was the time that I was first introduced to BioBrand. And of course, I did the documentation because I wanted to be convinced that this will work. And I found this case, oh, this is the first case that I would give BioBrand and let's see if it does really work. So he had chemo and he had 24 sessions of radiation. And this is what happened, no? The first, at one sachet a day, he had the white blood cell count of 3,600. Normal, the white blood cell count is 5,000 to 10,000. But this patient, at one sachet a day, he only had 3,600. I increased the sachet I think it's 1.4 grams per sachet. I increased the dose at three a day, three sachets a day, and then it because from here to here it was one sachet a day. From 3,600, it became 2,400. So I changed it to 3 a day, and dramatically, see, this is only a matter of 3 days. It went to 2,900, and then another 7 days, it went to 3,190, 3,700, until it went up to normal, which is 6,300. So this was the work of BioBrand. So this is why I was already starting, oh, this really works. So this is the effect. It increased the WBC count. Well, this is the picture of the boy. After several years, he became the captain of a basketball team. So that was a very good story. So, okay, so a little discussion on our immune system. We know that our immune system has the first line of defense, like the protective barrier, the skin and the mucous membranes. And then we have the second line of defense, which is the natural killer cells and the macrophages. And then the third line of defense, which are the antibodies. Now, this is where we will be interested in, because this is supposedly where the BioBrand will work. The natural killer cells. The BioBrand is supposed to increase, or according to a lot of data and a lot of studies, articles, they say that the natural killer cells activity is improved by around 300% by BioBrand. So that's very impressive. So if we know a little of the immune system, it's a collective army of a trillion of white blood cells, no? The bone marrow, antibody cytokines, and the thymus gland that helps to identify and destroy the millions of microbes like fungi, viruses, this is very important for us now, that penetrate our bodies every day, and the thousands of our own cells that have become genetically abnormal or cancerous. That's why I would give the BioBrand to cancer patients. In fact, the immune system is considered every bit as complex as our nervous system, and is not only able to produce a matching antibody for every one of the millions of infective agents, but is able to remember how to produce these decades later. So the innate immune system, as I was saying a while ago, that second line, this is the second line of defense. And let's look at the natural killer cells. Look at this. The natural killer cells will be concerned or will be responsible in handling the cancer cells and cells impregnated or infected with viruses. So this is where we are focusing on. So this is the structure of a natural killer cell, and this is the structure of a cancer cell. And we have a picture here of a natural killer cell attacking a cancer cell. So this is just to emphasize what we were talking about. And so here is the natural killer cell. It's attacking a cancer cell. This is the diagram. Now, today, we have the pandemic. So needless to say, I'm giving BioRun to a lot of my patients, although it says my internet connection is unstable. Is it still okay? Lisa? Hello? Hello? Ano naman tayo siguro? Hello?
Yes, it's fine.
Hello?
Yes, it's fine.
Is it still okay? Okay. 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 Because I'm worried because, you know, we don't have very good internet here. Okay. So today we are conscious about the COVID-19, and they found out that COVID-19 patients have greatly reduced number of natural killer cells. And the natural killer cells of these patients are greatly reduced in their functionality. They're very greatly weakened and they are severely exhausted. Now, there's a paper which showed that here that children have milder symptoms. In fact, 30% of children that are infected with COVID have milder symptoms, and they are 30% asymptomatic. And they surmise that the reason is these children have large number of natural killer cells. So this is one correlation that some doctors are recognizing, that if we have good natural killer cell activity, we have more number of natural killer cells, then we have a better ability to fight COVID. So this is not because I'm really promoting BioBrand, but this is what I'm doing in my practice. I am giving, although admittedly, the price might be a concern, no? It's quite expensive, especially in our setup here in the Philippines. So I'm not giving it like ivermectin. You know, I don't know if you've heard of ivermectin, but ivermectin is very cheap. So we are giving it for prevention. But in acute cases and in cases wherein I'm already very afraid that, you know, the complications would come in, I would really give a lot already of the BioBrand. As a matter of fact, there are cases I'm giving 2 sachets every 2 hours. And luckily, I don't know, by grace, I do not have yet a mortality, you know, in my case, but maybe I don't just have enough cases. But so far, the cases that I've been handling have been well. have recovered. So thank God for that. So, and here's another paper which has this finding that indicates that in the absence of both the T cells and the antibodies, innate defense mechanisms are able to control the SARS infection. This means that the innate defense, going back to the diagram of the immune system, refers to the NK cell. So, because the third line of defense takes time yet to develop. So the first liners would be the natural killer cells. Again, they are saying the reason for this is because the natural killer cells can really handle the first line of defense against the virus. So natural killer cells have a very big role, and natural killer cells are activated by BioBran. So there's the correlation. So BioBran is clinically proven to help powerfully enhance depleted immune systems. It effectively increases the natural killer cell activity by as much as 300% in just 2 weeks. Significantly boosts natural antibody production. It has an anti-inflammatory effect. It's an antioxidant. It has the ability to improve glucose tolerance and enhances pancreatic function even. So those are added benefits. And then it enhances liver function. And if it does so, then it enhances detoxification. It helps in the detoxification process. And then it reduces adverse effects of chemotherapy. As a matter of fact, with my chemotherapy patients, I highly recommend them to take BioBran together with the chemotherapy. It is easily assimilated into the body through the normal physiologic processes of the gastrointestinal tract. It is non-toxic. It is safe for infants and small children. It is fast-acting, taking only a few days for its immunomodulation effect to reach 90% of its peak. It's not a drug, it's not a chemical, it's not it's a GMO. Excuse me. So what is the dosage? It's 30 to 45 milligrams per kilogram per day, and the maintenance is 15 milligrams per kilogram per day after meals. But, excuse me, um, I do not really follow this. Excuse me. As I was saying in the first part of the talk, I am highly customized. Before, some of my colleagues would say you're crazy because I would give like BioBran 10 sachets a day. It depends, well, medical practice is an art. So anyway, I don't. So I still depend on my gut feeling or how much I want to give. So, but this is the basic recommendation. But for me, I customize my dosaging. So how do I monitor my cancer patients? I use tumor markers. I use CEA. These are markers of inflammation, high sensitivity seroactive protein. This is erythrocyte sedimentation rate. These are markers of inflammation. This is an indicator for cancer of the pancreas and the intestine. And this is, of course, the prostate-specific antigen. And then for immune system status, I monitor the WBC count in the complete blood count panel. And then, excuse me, of course, we have the scans and the x-rays, and of course, the clinical presentation. This one we use, I don't know if this is available, this is um, uh, known in your side of the globe. This is urine beta Hcg. We use this here in the Philippines because this is very easy and very cheap. So what is urine beta Hcg? This is a substance that's produced by the cells that are associated with rapidly growing cells, like a fetus, for example. We have urine beta Hcg. But if there is no fetus, and yet this is found to be high in the urine of a person, then we surmise that there must be a cell that is rapidly dividing like cancer. So it's like an indirect test. And it has been a useful tool for me in the monitoring of my cases. So Normally, the urine beta Hcg should not be above 49 units. And so most of my cancer patients, I ask to do for them to have their urine beta Hcg tested. So these are just samples of my cases which we use the urine beta Hcg as a monitoring parameter. And so, for example, we had this cancer of the lungs, cancer of the thyroid, you can see, because remember, the normal should be 49 and below. And you see, from here, it goes down to 64. From here, it goes down to 65 from 67.8. Here is 80.8, and then it goes down to 57, and so on and so forth. So most of my patients at that time, I tried to collate their values. These are these patients, different kinds of cancers. And then I tried to do a graph, and this is, just a simple graph. Actually, this was just really done to convince me that the biobrand or lentin, as we call it here, is working. And this is what I had found. So you can see the big change from the beta HCG number to this graph here. It went significantly down. So I did not need any more necessary convincing. Okay, so yeah, so let's look at some pictures that I took before. So this is a case of psoriasis, and as I was saying, I would give it at one sachet 3 times a day, and it gradually reduced. And this is the remaining picture. Can you see if you go back? See, this is January, and this is April. So you can see this big change. This is another case. This is a non-healing stasis dermatitis. This is November 23. See, November 3, and then November 26. Look at the big difference. There's another case of, this is herpes. And look at that, from May 15 to May 28. The wounds have improved. This is a very good case. She was diagnosed with tumor of the cancer of the sinus here. And we were giving one sachet 3 times a day. This is November 12, April, and this is now. Actually, this patient is still with me until now. She's very okay. Look at that. See, very, very big change. And so this is a comparison, the before and the after. And this is another case of psoriasis. Look at this hand. And see, so the development, the progression of the improvement, and gradually, look at that. See, this is the improved hand. This patient is also still with me until now. It's very dramatic change. So this is a before and after. There was a time, look at this. I was giving her one sachet every hour for 4 weeks. Look at that. Well, waking hours, of course, because I would not want her to also disrupt the sleep. But it's really dramatic. Okay, this is another case. And that was the remaining. So this is the before and after. One sachet 3 times a day. And this is just a furuncle, but it also got well. So this is one sachet 3 times a day for 1 week only. Look at that. Nice, huh? And then, oh, this is my sensational case. This is, of course, cancer of the breast. And we were just really using that. Well, we were also using a lot of detoxification, supplementation, but BioBrand was part of the immune stimulation modulation program. and this is this. From that big tumor to this. This patient is still alive until now. All of the cases that I showed are still with me until now. They're all well. And you know what? They could not totally remove the BioBrand. Some of them are taking it like once every 2 weeks, or maybe one every 10 days, because because of the cost. And the Philippines, we are a third world country. But some of them attempted to really take off, and then after some time they would feel weak, or they would feel not healthy. So out of their own volition, they themselves would ask me to still continue giving it, and then I would just tell them, okay, you be the best doctor to yourself. You know how much you need, and how you can just make your own dosaging based on how much your body needs and how much you can afford. So that's the reality of my practice. So also, okay, so in conclusion, although we cannot deny the value of detoxification and nutrition in the management of diseases, BioBrand is the top of the line immune module. This is not because I want to advertise BioBrand. It's true. This is really my top of the line. Well, top of the line also in the cost, but top of the line in the quality as well. I can vouch for that. Among patients receiving Western medicine therapies, the care of the immune system is something that is not given attention to by regular doctors, which is, I think, true. It's therefore, without doubt, very important that patient undergoing any type of treatment, Western medicine or alternative medicine, there should be an immunomodulator, of which BioBrand should be the one. Now, as an addendum, I think I would really like to emphasize the emotional part in the holistic management of patients, because it's very, very important, especially now in the pandemic scenario, where a lot of people are frustrated, disappointed, depressed. And it's very, very important to emphasize that the state of mind, the peace of mind, should be a primary concern, because I believe that the depression and the fear and all these negativities can create a disease. And if that is the cause, it is, the emotion is the cause, it's very difficult to treat, because you cannot have a pill for the emotions. So I like this passage, or this so I got this from Dr. Deepak Chopra. I don't know if he's the one who really said this, but it says every cell in your body is eavesdropping on your thoughts. See? So if you are sad, if you're angry, if you are frustrated, your cells are having the same situation. So you are an easy target for a disease, a degenerative disease at that. So stress is a very, very big thing now. So very, very big thing in the 21st century. So to end this talk, I would like to emphasize that emotions that weaken specific organs. Anger can weaken the liver. Lungs can weaken, grief can weaken the lungs. Stomach can be weakened by worry. We know this when you take exams, you have, butterflies in your stomach, you don't like to eat. Yeah, so when you're worried, you do not like eating. And then kidney can be weakened by fear. So people can urinate often when they are afraid. I saw this movie Ransom, when that little boy was kidnapped, and his father was very rich, and he talked on the media that he would give a reward for the kidnapper, for anybody who can return the boy, and the kidnapper returned the boy. And he was not, he said he found the boy. The father assumed that he did not realize that he was a kidnapper. And then when he went back to the house to collect the house of the family, to collect his reward, the boy heard the kidnapper's voice collecting the money, talking to his father in the father's office, and the boy was speechless. He just urinated, and that the father saw, and he understood that this man is the kidnapper. This is the movie Ransom. So kidney is affected by fear. So peace of mind is very, very important. Now, let me uh, show you a little joke. It says, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. Okay, so thank you very much for your attention, and that ends my talk.
Dr. Lao, that was amazing. Thank you very much. We've got
Okay.
a couple of questions if you have the energy.
Okay.
Someone's asked,
Yeah, sure.
do you ever use coffee enemas for detoxifying your patients?
Yeah, before I did that. Yeah, now we use that. I'm not doing it anymore because there are lots of nurses doing that. There are also private practitioners doing the enema. Yeah, we use that. We use enema.
And another question is, how do you deal with a patient that's got an overactive immune system?
Yeah. Yeah, that's a very good question because we have lots of that. This is where customized management would come in. So many factors will have to be considered, from heavy metal toxins to stress in the job, to food, to so many factors. So with cases like that, it's a long time relationship wherein I really have to do an elimination process. It's not like, oh, I'll give this because you have an, no, I need to understand what's going on in his body. So it's highly customized.
Yeah, the root cause. Yeah, absolutely.
Yeah.
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 So there was another question. Are you seeing a lot of long COVID, as people have been using Biobran? Yeah. Dr. Lao, did I?
Yes. Yeah. What was the question?
Yeah. Are you seeing a lot of people that have long COVID, and are they having some success with the Biobran?
Lung cancer? Huh? What was that?
Long COVID. Sorry, COVID.
With COVID,
Yes.
and using Biobran?
Yes.
And the question is, if they are using it?
Yeah, you're seeing success with that.
Oh, yeah.
Yeah.
Just the other day, I have this patient. I had to really give the one sachet 3 times a day. I'm sorry, we have a gecko in. Are you hearing that? Sorry, that's the gecko in our house.
Oh, you got a gecko.
Sorry.
Amazing.
Yeah, that's the house lizard. Oh my God.
He's joining in on the webinar.
Yeah. Okay, it's done. Okay, yeah. So I've given one sachet 3 times a day. But it's not long, because you cannot really they cannot really maintain. But maybe I've given for the longest for COVID cases for so far 2 weeks. 2 weeks, one sachet 3 times a day.
Okay, amazing. Someone asked with the psoriasis, do you also do a detox diet and other supplements along with the Biobran?
Oh, yes. Yeah. Yes. As I was discussing earlier, the detoxification pathway, the first thing that we do is really to clean the intestine. So to clean, and of course, very, very careful. The what you call this, the diet has to be very, it's not listed. I mean, I instruct the patient to list down each and every food they eat for the day. So it's an elimination process, and again, it's a customized management. And then we watch the flare-ups. So what did you eat last time? Why did we have this flare-up? What did you do? Did you sleep early, or who did you talk to? Were you angry, or were you sad? All these things.
Yeah.
Really. Yeah.
Great.
Yeah.
And just another one, we all seen homeopathy work, but how does your doctor's brain get around to make an explanation of how it works?
Homeopathy, you mean?
Yeah, homeopathy. Yeah, we all know it works. We've seen it, but What's
Oh
your
yeah,
take on?
I'm not anymore very much using homeopathy nowadays. But yeah, it's the principle of like yours like, right?
Yeah.
If you, yeah, so it's I've used homeopathy a long time ago,
Mhm.
but I found out because with the onslaught of so many patients, I found out it's difficult to use homeopathy. I don't know, but I stopped using it. But the principle of homeopathy is that you you give a small amount of the very substance that causes the problem, right?
Yeah.
So it's the principle of like yours like.
Yeah.
Yeah.
Lovely. The gecko seems to have calmed down now. Well, lovely. I think all
Okay.
of our questions. So unless anyone else has got any they want to add, Dr. Lau, that was
Yeah,
fantastic.
you can probably, Luisa, you can probably give them my email address and I can I answer in full detail better, I
Oh,
think.
that would be
Yeah,
fantastic.
if somebody would like to email me and, ask questions in detail, so I can
That's
answer
brilliant.
in detail also.
That's
Yeah.
very kind.
Okay.
Thank you very much. Thank you
Yeah.
so much for your time
Okay.
today. It was an absolute pleasure.
Okay. Thank you also for
Thank,
having me.
thank you. Have a lovely
Okay.
day. Bye-bye.
Okay. Bye bye.
Bye bye.